Good morning everybody, this is Dr. Mohammed Ahmad. We're here at the Training Academy here in Harley Street just now. This morning we're doing a session and this is one of our models here just now, which I thought I'd share with you first. And this is Ruby. Ruby's coming to us with, she wants non-surgical rhinoplasty with a deformity that she has on her nose area here. We're going to try and correct it. She said she doesn't want her tip lifted because it'll make the deformity a lot more pronounced. So we're going to try and working on giving her a non-surgical rhinoplasty on the nose over here. Okay guys, so just taking off, we've taken some pictures of our model Ruby and we're using a 3D camera for a 3D analysis. And what we're going to do now is we're going to have an analysis of what is actually required. So come on, if you can actually show us, if we look anteriorly, yes, we can see a slight dip, and if we do a side profile, yeah, you can see it's required in here and in here. However, it doesn't appear to be that much is required. Could you just, put the measurements up and let's see what the computer shows. Excellent. So here we go. So this is what the computer is doing, the 3D analysis. It's showing us that this is our gap area from here to here. So what we'll do is we'll look at that, we'll go back to the patient, we'll mark it up, and we know that's a point of injection that we have to give a desired outcome to the patient. Now what we've got is we're just going to start injecting with Ruby. The filler that I've chosen to work with is one called Oralia 3. And this is by a company called Bioformula, who are an Italian firm. Now, the reason I've chosen that is they're involved in the manufacture process from A to Z. They're not importing in hyaluronic acid from somewhere else, so the quality controls are quite stringent. Also, it's a reticulated monophasic hyaluronic acid product. It's 30 mg per ml. Ruby has had a filler before, and I think the issue was that it migrated, and one of the risks of fillers in the nose is that it can migrate. So this is a good dermal implant which will not move. It's very, very important that it doesn't move. And the indications for Ruby here is it's a disrupted dorsal angle over here. So that should sit quite nicely for what we're looking for. I don't think we're going to be able to use it, Ruby. I didn't want to give a little surprise for you. I know you've had a bit of work done on this cheek, but sometimes I feel just a little top up here. And again, that's an amazing dermal implant that we can use, and we'll just do that for you as well as we're coming along. Okay? So, let's go to clean the area. Now, one of the things is that when we are injecting over here, you have to be careful of the blood supply in the nose. The dorsal nasal artery up here, the lateral nasal artery, superior nasal artery, and the arteries on both sides, well, anastomos up here as well, and they're coming up, the branches of the facial and the angular arteries. So every time we're injecting, we're pulling back just to make sure there's no blood supplies, etc., because these are then connected with the supratrochlear and the supraorbital nerves around the arteries around the eye area. So it's very important that you're watching the anatomy of what you're doing. It's absolutely vital to ensure that you know that the blood supply is prevented. We've done the nose. I really like it, Ruby massage. It's quite nice. We'll show you it. I know I've got a little bit left. And remember, I don't know if you remember your scan, it showed the wrinkles on this side were a lot more. And remember when we had the cheek work done before, this side needed a bit more. So I've got that. I might just put a couple of boluses in, and just to get that done, and then we'll get you scanned again. So again, a subperiosteal onto the bone, a nice downward implant that's going to lift this up for Ruby. It's going to hold that in there. Okay guys, so we've done the procedure and we've had a nice softening of the dorsal area of the nose. We've given it a lovely bit of straightening, as natural as possible. And also we had some left, and she had a bit of deformity, you know, just a volume loss on the right cheek here. We've managed to lift that as well. So we'll just show you the before and after pictures in both these areas, but we're quite happy, and I'm sure Ruby, when you see it, you'll be quite happy too. Okay, thanks very much guys.